If your initial assessment of a patient with an allergic reaction indicates the possible administration of an epinephrine auto-injector, here are the steps to follow. Take BSI precautions. Obtain patient's prescribed auto-injector. Ensure that it is the right medication, the right patient, and the right expiration date. Make sure the medication, if visible, is not cloudy or discolored. Obtain an order from medical direction, either online or offline. Keep in mind the 5 rights involved in administering any medication. Ensure that you have the right patient, the right drug, the right dose, the right route of administration, and the right time. Explain the procedure to the patient. Remove the cap from the auto-injector. Expose the thigh area. Place auto-injector device on the lateral thigh, midway between the knee and the waist. Tell patient they may feel a stick from the needle. In a smooth, direct 90-degree angle, push the injector firmly until you hear the device inject the needle. Hold the injector in place until the medication is injected, or for at least 10 seconds. Remove auto-injector. Dispose of the injector in a sharps box or biohazard container. Document your findings. If glucose administration is indicated, complete the following steps. Take BSI precautions. Consult with medical direction and/or review any standing medical orders or protocols on administration. Check the 5 rights of drug administration. Do I have the right patient, the right drug, the right dose, the right route of administration, and the right time? Confirm the patient's ability to swallow and the presence of a gag reflex. Explain the procedure to the patient. Open the tube, keeping it clean. Apply the glucose by squeezing it onto the tongue depressor. Insert the tongue depressor with the glucose into the patient's mouth. Apply between the cheek and the gum, or under the patient's tongue without using the tongue depressor. In some cases, the patient could self-administer the glucose by directly squeezing the glucose into their own mouth. Remove the tongue depressor. Confirm that the patient can swallow. Reapply the glucose to the tongue depressor and continue the administration until the glucose is gone from the tube. Immediately discontinue administration if the patient loses the ability to swallow or becomes unresponsive. Consult with medical control as soon as possible. Document your findings. Now let's take a closer look at performing this skill and some problems you might encounter. Take BSI precautions. Assure that you have the right patient, the right medication, the right dose, and the right route. Explain the procedure to the patient and get his or her consent for an assist if needed. Shake the canister vigorously for at least 30 seconds. If the patient is wearing a mask, remove it. Instruct the patient to hold the inhaler upright in his or her hand. If the patient cannot do so, then you should hold the inhaler. Place your thumb on the bottom of the canister and your index finger on the top. Tell the patient to take a deep breath and to exhale fully. Have the patient quickly place his or her lips around the mouthpiece, making a tight seal. Direct the patient to take a deep and slow breath over a 5-second period. Simultaneously, either you or the patient should depress the canister. Make sure the patient has started inhalation before the canister is depressed. Remove the inhaler and request that the patient hold his or her breath for 10 seconds or for as long as possible. Coach the patient to exhale slowly with pursed lips. Put oxygen on the patient if needed. Document the procedure. Let's take a closer look at the steps involved. Take BSI precautions. Consult with medical control or follow local policies and procedures. Reassess the patient's ability to use the nebulizer. Explain the procedure to the patient. Reconfirm the 5 rights of drug administration. Unscrew lid of nebulizer chamber. Add medication as directed. Reattach lid. Fasten the T-tube to the nebulizer chamber. Connect the mouthpiece to one end of the T-tube and the flex tube to the other end. Attach oxygen connecting tube from nebulizer to the oxygen source. Adjust oxygen to 6 liters per minute. You should be able to see a mist coming out of both the flex tube and the mouthpiece. Ask the patient to sit as upright as possible. Ask the patient to hold the nebulizer in their hand and to place the mouthpiece firmly in their mouth. Lips should be sealed tightly around the mouthpiece. Ask them to breathe deep and slowly through their mouth. At times it may be necessary to shake the chamber slightly to remove medication attached to the wall of the chamber. Continue this treatment until the full amount of the medication is gone. Document this procedure. Vital signs should be retaken every 5 minutes, and the patient should be constantly monitored for changes. Remember that there is always the possibility of the medication causing a hypotensive event. Take BSI precautions. Be sure to wear gloves at all times. A nitroglycerin pill can be absorbed into your skin if held long enough. Consult with medical direction and/or review any standing medical orders or protocols